South Korea's tally of patients infected with the Middle East respiratory syndrome rises to 7. Meanwhile, a private laboratory in Maryland alerted the U.S. Center for Disease Control that it received a live sample of anthrax. 8 other states have also reportedly received the same. Christine Domingo tells us why.
In America, the Pentagon said on Wednesday that a suspected live sample of anthrax was sent to a U.S. base in South Korea, in addition to the samples mistakenly sent to 9 U.S. states. U.S. authorities, however, stress no personnel have shown signs of possible exposure. They have recommended that 4 civilians take precautionary medication in the form of preventative prophylaxis. The Pentagon said the anthrax had been meant to be sent to laboratories in an inactive state as part of U.S. military efforts to develop a field-based test to identify biological threats in the environment. The mishap comes 11 months after one of the federal government's top civilian labs, the U.S. Centers for Disease Control and Prevention or CDC in Atlanta, had a similar biosafety accident. A U.S. defense official said in the case of the U.S. military's mistake, the samples were sent from the U.S. Army's Dugway Proving Ground in Utah to laboratories in Maryland, Texas, Wisconsin, Delaware, New Jersey, Tennessee, New York, California, and Virginia. In South Korea's tally of patients of Middle East respiratory syndrome or MERS rose to 7 on Thursday, May 28, with authorities saying one suspected victim skipped out of voluntary home quarantine to take a trip to China. A rise in MERS cases has stirred alarm in South Korea, with health authorities being criticized for not moving quickly and effectively enough to quarantine suspected patients. 2 new victims are believed to have caught the virus from the first case confirmed last week, a 68-year-old man who had traveled to Bahrain in April and May and returned to South Korea via Qatar. The health ministry said the son of the second confirmed victim of the outbreak, who was himself being observed for possible infection, broke voluntary home quarantine and left South Korea on Tuesday for China. Chinese authorities are investigating the whereabouts of the suspected victim and are expected to announce the results as early as Thursday. Christine Domingo reporting for Y News.